now, wherein we are able to diagnose more. That's why you see more cases. Now, there's still no cure for COVID-19, right? It's virus, no, it's a virus, so it's self-limiting, but you can also be at risk for co-infections. And we have seen that, and probably the co-infections are due to the fact that there are other viruses in the area, right? And in our country, we have seen co-infections with dengue. We are a dengue endemic country as well, right? So the possibility of having a bacterial infection, especially with prolonged hospitalization, is also there, right? So as clinicians, we have to look at the whole picture and not just attribute everything to COVID. Over.
Yeah.
Okay.
Thank you, Dr. Demi. Is it true? Is the number of asymptomatic COVID cases in children skewed because children are not being tested routinely, or as a matter of course? This is also as a follow-up from Ms. Telly Hao on Facebook.
Dr. Telly Hao yan. No.
Oh, Dr. Telly.
That's Dr. Telly Hao. Yes, I must admit it's skewed because we really don't routinely test children, okay, who present to us with mild respiratory symptoms. More kung asymptomatic sila, we really don't. Even in families right now, we're seeing family clustering, di ba, of COVID disease. What do we do? Ang ginagawa, di ba, we do contact tracing and then we quarantine them. But if they remain asymptomatic, most of them hindi na natetest eh. Although there are some LGUs who would recommend swabbing for an RT-PCR test to check whether they have been infected or not. But not know the exact numbers, baka nga marami yan.
Thank you, Dr.
Okay. This one, Tina, I'm looking at this one. Due to prolonged lockdown, mental health of children has also been affected. Does the PPS have statistics on mental health status of children? And as for follow-up, what advice can you give parents in explaining the health crisis the country is experiencing?
Man, you go first, or talking about?
No, I think Bambi is the better person to answer that.
Right. Bams, join in the conversation. Yeah.
Well, I will if I can, but mental health statistics, PPS, I think it is the psychiatric association that is actually having a study on this mental health in children. And as for advice, well, our advice is always standard. I think, ladies, preventive measures. The Philippine Pediatric Society dapat, as with the 3 mask and your face shield. HPAC goes a little bit further because, of course, now it's aerosol, airborne transmission. So there is a concern for air circulation, keeping it open, no? And then also for physical distancing and wearing of mask, always wearing a mask, and the time interaction to make it short. Okay. So
siguro, Bambi, if I may add, no, hindi ako nanay, no, pero I think siguro, man, sorry, that's why I posted it to you, no, having children. How can we? Okay, what's the practical solution? Alam mo, on the positive note, I think people have been gone much closer sa families, no, because physically they need to stay at home. So I think, you have to devise activities that will, inspire and encourage your children, Because with this situation, we have to reap the benefits of being together. So you yourself, all of us are very anxious. All of us are very tired, but keeping an upbeat person in the home is something that we would like to see. Pag may masaya, di ba, lahat sumasaya. So just, that's one practical advice, I think, because you did ask about an advice. Thank you.
You may not be a mother, but you are a great tita. So, ilaw ng tahanan nga daw, di ba? Okay. Tina, is there anything else?
Yeah. Since there's no COVID vaccine yet for children, is having pneumonia vaccine now enough to avoid possible high-risk COVID?
Okay, so ang coverage rates natin ng 2020. And it's really pretty difficult, no? Because of the pandemic, madaming tao ang hindi nakakapunta sa mga local health centers. And you know that there are a lot in ating fully immunized child consists of the following. Please allow me to say this, no? And about 90 to 95% of the ang DPT-3, ang polio, ang IPV, ang PCV, at ang dalawang measles, mumps, and rubella. So when you talk about the pneumonia vaccine, I think you're alluding to our pneumococcal vaccines, no? So having those, okay, kasi talaga naman kahit walang pandemya, kailangan yan. Very vulnerable ang mga batang 5 years and below sa mga respiratory tract diseases, and ang isang bacteria na very, prevalent sa age group na yan ay ang pneumococcal disease. So yes, okay, it's very important. That's why we need to encourage, okay, both the private sector and the to just, let's help out our Department of Health in catching up with the needed immunization. So in a nutshell, yes, makakatulong.
Humina yata ang internet ni Timmy.
Oh,
Yes, what?
would you have another question and Doctora?
On immunization.
Yeah.
Immunization, there is a question here from Sarah Claudine Santos. A few days ago, there was news that Sinovac is applying for EUA from our FDA so that it can be given to our children as young as 3 years old. What is your comment, and is our society involved in this? Thank you.
Bambi,
Yes.
okay, the
Give me a yes.
application of Sinovac is actually approved only to conduct trials. To conduct trials in children aged 3 years old to 17 years old. So
we have it here.
Yes, because they will be conducting clinical trials in children and check whether it's going to have very good vaccine efficacy in these age groups of children.
Okay, so there you have it. We'll just await results of that clinical trial. Okay, and
From Ms. Kilantang, what is your view on Ivermectin use?
Sorry, Tina, I didn't quite catch us. What is your view
on Ivermectin use?
We never use ivermectin in children. That's my comment.
And on that note, right, I may, in espousing that for the drugs that we have, there should be judicious use, and let's just use it for the proven indications. Over, thank you.
And if I may also add, the Philippine Society of Allergy, Asthma, and Immunology has a review on immunomodulators used for COVID-19, and part of that ivermectin group. And we've reviewed the meta-analysis studies on those ivermectin use, but they were, of course, mostly on adults. And the results have not been gratifying because of a lot of biases in some of the studies that we reviewed. Both WHO and the British associations do not still push for ivermectin to be used even as prophylaxis or treatment for COVID-19. There are still some clinical trials, so we still await these trials to give us more data on use of ivermectin. But as of now, it is not part of standard of care for COVID-19, whether in children or in adults, whether prophylactic or active treatment. Thank you.
Doctors, is it possible to vaccinate children on immunosuppression, low-dose alternate day steroids? Shall we prioritize these children if the vaccine is now available in their age group?
May I answer?
Yes, you answer it na
Right.
lang.
Okay. So, first of all, let's go into the general principles of immunization. Definitely, okay, for us, we need to know the exact definition of immunosuppression. So, in general, those who are immunosuppressed, okay, those who are on high dose steroids more than 20 milligrams per day, and we're talking about okay, certain populations that we need the vaccines in general, it's safe, but you don't expect the same response as that of immunocompetent children, right? So for most of the vaccines that are recommended, okay, inactivated vaccines may be given to them. Now for live vaccines, now you have to assess the patient first, right? So for those who have HIV, okay, their counts, right? And then, as I have said, those on high dose steroids, or those who have just undergone transplant or have certain chronic conditions, then that needs to be studied very well. Now, for the COVID vaccines, that's one of the things that I did point out that we are still learning, okay, how this vaccine in the real world. Okay, when you say in the real world, you're talking about clinical trials now, but we are still learning and how effective it will be in the real world. Like how many really are, how many infections are being prevented. But let me just reiterate, for all the vaccines, okay, we get vaccinated. Why? Because this prevents deaths, and of course, it prevents you being severely ill, but there is still, okay, a risk for infection. Thank you.
If I may add also with the subject of immunosuppression. Immunosuppression by itself should not be a contraindication for vaccination.
Right.
The important thing is actually to get vaccinated because that is the biggest risk of all, getting the COVID-19. Immunosuppression or those with immunosuppressive medication, under immunosuppressive medications, whether it be cancer or some other rheumatologic disease, they are not actually contraindications for receiving the vaccination. What we do not know is how their immunity will be,
Right.
how effective will the vaccine be. You must understand, everyone, that our vaccines are still under EUA. They still don't have a certificate for product registration, so they're not yet finished with all clinical trials. The phase 4, which actually studies all these marginalized, specialized groups, including those with immunosuppression or immunosuppressant drugs. So until we know further, the idea is get them vaccinated, but advise them that we still are not yet sure as to how effective it will be for these patients, but it is still worth giving the vaccine to these people instead then a vaccination, then there may be some protection. Just as to how much the protection would be for these immunosuppressed patients, we still are not sure. But yeah, vaccination is still the way to go.
I would like to entertain a question from Mr. Rafael Bosano from ABS-CBN. So Dr. Casala mentioned we're not getting the real picture of COVID in children. Aside from the Salvation Registry, how else can we get the true state of the disease in children? Do you think LGUs, especially those with dense communities, should also push for regular testing of children? And in follow-up, is the viral load of a child with the virus the same compared that of an adult?
Dr. Tin, it would have been very helpful if the LGUs can push for that. If they have adequate, then that would be very ideal. Unfortunately, hindi lahat kasi ng LGUs merong RT-PCR test, perhaps because of the cost. Medyo may cost kasi yung RT-PCR. Okay, that same as in adults. There have been reports or there have been articles saying that the viral load of children is the same as in adults, but more evidence the data still is inconclusive. More evidence is needed to really say that the viral load of children is the same as in adults. Thank you.
Do you
Go ahead.
think, Dr. Abuni, do you think that the parents themselves are actually apprehensive into getting an IAATF resolution asking for mandatory isolation in government-run facilities? Would that be affecting our testing, or is it more economics? Or
For me, it's more economics kasi everyone naman would like to know whether their household members have been infected or not. It's just that, there's a cost in doing the RT-PCR test. And imagine if you have 5
totoo naman.
family members or
Yes.
household members, and how much does it cost? If you don't have a PhilHealth, it ranges from 3,500 to 8,000 per test. So I go more for economic, hindi siguro apprehension that their kids will be isolated. Kasi ang recommendation naman natin, the safest place for these kids, especially the young kids, will be still at home.
Okay. So that resolution will allow home isolation if they have facilities for that, right?
Yeah, siguro those children enough
No,
to
wala.
be independent enough to take care of themselves to be
The
placed in
kids.
isolation facilities.
Thank you for that clarification. Okay. Yeah, kasi mahal talaga ang
can I-
RT-PCR, no?
Yes.
Yes.
Oo.
But
I know of
ideally,
families who are, I'm sorry, sige.
If cost was not part of the factoring, would you test children if they are symptomatic but there no exposure to COVID? Is this something that we will do?
If there's no exposure and then they are asymptomatic,
They are
and
symptomatic.
they are symptomatic, yes, because your COVID-19 is similar to other viral infections like flu.
Oh,
I would still test them.
okay. Can I beg your indulgence? We have somebody from TV5 who would like to raise a question. Can we give the floor to Mr. Greg?
Good morning po, Doctors.
Greg Gregorio.
Good morning.
Morning
Morning,
po.
Greg.
Doctors, the DOST has recently flagged deficiency of vitamin D daw po among 1 out of 10 Filipino kids amid lockdowns and the threat of transmission of the COVID-19 po. What's your recommendations po for parents to closely monitor the nutrients and these vitamin sufficiency of their children po?
Well, if I may, right? So vitamins in general just help you overall, right? But it's still, what is key is good nutrition. Okay, eating the right food, and you can have enough sunlight, right? There are ways wherein you can expose yourself to sunlight. That's also one way we can help with our vitamin D. So I don't know if there are studies really with regard to the use of vitamin D per se, and I don't know, Bambi, do we have a level of vitamin D deficiency? Forgive me. Hindi ako sigurado, magtatanong din ako sa aking mga colleagues. No, rather than
Sorry.
saying something. I don't know if you know the vitamin D level in our pediatric population as well. So, ang nakikita lang
not
natin
too,
kasi is more of foreign literature. And, just seeing literature doesn't mean it's, Bible truth already. So, just an attempt to answer your question and being very honest about it.
Thank you, Mr. Greg.
Thank you po.
Greg, there is no PPS or PIDSP official recommendation in this. So, but as soon as we have a study on it, then we will usually issue out an official statement and we do call a media conference for such updates. So
Yeah.
you'll be first to hear of it, Greg.
Yeah.
Thank you for your question. There's a
Um,
question here from Myla Baturiano. Can we use COVID antigen test in children for screening for patients to be admitted?
Ems?
Okay. You know, we also have to be very careful, no, with regard to that, because on COVID antigen test, no, we only use it, using it should be you are symptomatic and you use the rapid antigen test. Okay, so more likely it is true, right? But for those who have symptoms but turn out negative with the rapid antigen test, you still need to have a validation, okay, with your RT-PCR. And let me just say that your RT-PCR turning negative or positive, remember that's just a snapshot in time. If you are, if you have been exposed, okay, the incubation is 2 to 14 days. That's why kahit negative ka, but you were in close contact with a COVID confirmed case. That's why you isolate for 14 days. It's still possible that if you swab negative your RT-PCR, you can still be incubating the disease because in general, we see people manifesting symptoms, all right, around 6 or 7 days. That's why that's also the recommendation on when your diagnostics should be given. So your rapid antigen test, okay, if you have the symptoms, okay, more likely you are. But if that's negative, you need a confirmatory test. Over, thank you.
Thank you, Dr. Artemi. I think this one is specific to the lecture of Dr. Rabuni on updates on COVID in children. As a follow-up of Mr. Morong from GMA7, how did we select the 8 hospitals to survey for cases? It only shows around 415 total, but your registry, Salvation Registry, has more than 1,000.
Yeah. Hindi talaga magtutugma yan because ang choice or selection of the Salvation Registry is a registry nationwide. So this one, the data which I have presented, if you will note, is actually hospitals within Metro Manila. And I was just able to contact one of our PIDSB members who stay in Zamboanga City Medical Center, which is still a DOH hospitals. So the selection process there was to know or to select hospitals which are COVID facilities and select hospitals where there are members of the Pediatric Infectious Disease Society so that data can be gathered immediately. So there will really be a big discrepancy. I hope I answered Mr. Joseph Morong's question.
I think so.
Yes, I think so.
Yeah.
We're past 10, but I would like to, would you please indulge another live, what do you call this, question from Mr. Red of Manila Times. Are you there, sir? Could you turn on your video?
I read.
Okay lang po,
Suki yan sa Suki yan sa HPA. Yes, Red, go ahead with your question.
Good morning po. Pasensya na po, di ko po ma-open yung video ko right now kasi may problem po yung camera ko. So, ang question ko lang po kasi may research na po ba on children getting yung long COVID or longer lasting symptoms ng COVID-19? And also po, ma'am, ano po ang pwede nating gawin? Kasi of course, children getting COVID, of course, they will be isolated, they will be quarantined. And more often than not, mag-isa lang po sila sa mga quarantine facilities or dun sa mga hospitals, and that could lead to stress and anxiety among children and parents themselves. So how can we resolve that, yung ganitong issue ng stress and anxiety sa mga ina-isolate ng mga kids natin, mga bata na, mga anak natin or mga children natin. And of course, even the parents ng mga na-isolate na bata, of course, they feel stressed and they feel a bit anxious kasi they are worried so much about their children getting COVID.
Mr. Red, this is Dr. Rabuni.
Yes, ma'am, Doc.
In one of my slides, isa yan na kailangan pa nating malaman, yung sa first question mo, kung meron na bang pag-aaral in terms of the outcome of children who recover from COVID as in terms of yung mga long-term complications. Wala pa talaga tayong datos tungkol dyan. So it's a research gap that doctors may be interested to explore on. Although dun sa ibang mga international articles, persistence of some symptoms meron. Pero hindi pa rin natin gaanong nakikita kasi yan among Filipino children. Kulang pa talaga tayo sa datos. Kaya kailangan pa nating pag-aralan yan. So, tapos yung number 2 na tanong mo is about paano ba natin matutulungan ang mga magulang in terms of isolating or quarantining children who get exposed to COVID-confirmed household members. Yun ba yun, Mr.
Yes,
Red?
hindi ma'am. You, of course, I've seen an article na in Australia na yung mga bata doon sa hospital, they are being isolated and parang walang magulang na kumakalinga sa kanila, of course, because they are isolated. And I think that could be a big stress and anxiety trigger. Kumbaga, I mean, children are expected to be with their parents on their side, pero yun nga, ang nag-take care sa kanila is doctors and doctors or nurses. So, how can we resolve this?
How can we alleviate those issues? Alam mo ngayon, meron yatang move ang Philippine Red Cross kasi kinontak din ang PPS at ang PDSP kasi meron nga daw dumadating doon ng mga adults na may kasamang bata kasi nag-positive sila. So, ang ginawa naming mungkahi is for them to be cohorted in one room kung kaya ng Philippine Red Cross na gawin yun. Kasi ang pag-uusapan mo dyan, yung manpower ng Red Cross at saka yung logistics. Pero kung kakayanin naman, mas mainam na magkakasama yung anak at saka yung magulang. Kasi ang hirap nga naman na intindihan ko yung sitwasyon ng mga magulang. Pati ng mga bata, ihihiwalay mo yung mga bata sa kanila. So kung merong facility na pwedeng i-cohort ang isang pamilya, bakit hindi? Kasi mas mainam yon. I hope I answered your question.
Yes po. Okay po. Sige po. Salamat po mga doc. Salamat po.
Thank you, Red. And thank you to our speakers and of course my co-moderator, Dr. Cristina Patricia Tanbolyong Paras. On that note, we will be ending this media conference on updates on COVID-19 in children. You heard from Dr. Bunyi herself, an overview of COVID-19 in children, presenting as fever, colds, cough, and some difficulty of breathing, with about a lot of children also of those hospitalized having some abnormal pneumonia X-ray, but not needing oxygen support. So that is good. They seem to be, even if they're hospitalized, they do not need very expensive or extraordinary measures to actually get them through their illness of COVID-19. And you also heard from Dr. Bunyi about the Salvacion Registry. So doctors out there, you are encouraged to join the Salvacion Registry by sending in your details of your COVID-19 patients in children, no? So we can continue studying about COVID-19 in children. And of course, wrapping up, Dr. Timmy Jimenez talked about vaccination concerns of COVID-19 vaccine in children. As of now, even if Pfizer has an EUA for 12 to 16 for vaccine, We're still not giving it as of now. They're still not on the priority list. However, as soon as we get vaccines, more of vaccines available, then perhaps we can already get the vaccine rollout for these teenagers. And we heard also from Dr. Mian that a study on Sinovac, for 3 years, 3 years and above, would be done in certain clinical trials. So that is not for commercial consumption just yet. So before we go, of course, the Philippine Pediatric Society would like to remind everyone of the preventive measures against COVID-19, the 3 W's of wearing your mask, watch your distance at least 1 meter or 3 feet away from other people, and washing hands with soap and water for 20 seconds. If not available, sanitize. Okay, and of course, this also goes in tandem with the HPAC Apat Dapat. HPAC is Healthcare Professionals Alliance Against COVID-19. The Philippine Pediatric Society is a proud member of HPAC, and ito po yung Apat Dapat kasi incorporated din po yung 3 W's dyan. So air circulation and ventilation, physical distancing, always wear your face mask, and make it your time of interaction less than 15 to 30 minutes. So andito na po ang Delta variant ng COVID-19 nga, pero bukod sa bakuna, pag-iingat ay kailangan pa din. And of course, as Dr. Timmy said, championin natin ang immunization, hindi lang po pang COVID-19, pero para po dun sa ibang mga sakit na meron pong preventive na bakuna. So maraming salamat po. Tina, any last comments?
None. Thank you, ma'am.
Okay.
Thank you very much for wrapping it all up. And thank you everyone for your presence in this media conference. Thank you to our speakers for indulging their time.
So thank you very much to our press contacts. Thank you for listening out. And I know we went over time, but I'm sure you all learned a lot. It's been a good morning, everyone, and have an enjoyable morning. And there is our president, Dr. Jocelyn Eusebio.
Congratulations!
Okay.
Congratulations! And first of all, thank you sa team, na press, and of course, our excellent speakers. Thank you so much. And to the press, sana po, lahat po ng natutunan natin ngayon, yan po ang ating sasabihin. Opo. Salamat, salamat.
To our media friends, you will be provided with a press kit of this morning's proceedings. Please send your email address if you have not yet received your kit. So this makes it easy for you to actually disseminate what we just discussed. Thank you so much again. God bless. Take care, everyone. May we ask the PPS press and SHIC to stay behind? And officers and
Pwede na kami mag-leave.
Well, and Facebook. Picture daw po
Picture tayo.
and Facebook please and the streaming.